about the reflexes. So I will start with a bit of theory, and then Panshu will go through each one reflex, explaining why we need it, how it works, what is the afferent, the efferent. So I will start with the basic question, like what is a reflex? Like that's the basic question. What is a reflex? Can someone answer about what is a reflex? Kirari?
Yes, it's a rapid involuntary response against, like, for a certain stimulus.
Yes, yes. So basically, it's an involuntary reaction in response to a stimulus. That's a reflex. That's the basic definition of a reflex. And you're right. And these reflexes have some characteristics, right? So what are the characteristics of a reflex? Shivani? I need 3 characteristics.
By characteristics, I don't get it. Like
features of a reflex, like what are they like specialized at? Why are they important? Like, for example, one could be they are stereotypical. Every time we do it, it's the same movement, it's the same reaction. Like it will not be one time it will be contraction and the next time will be extension. It will always be the same, stereotypical. What other 2 features do they have, the reflexes?
I don't know, but guessing that they can come with like since born innate reflexes.
Okay. Yes.
And maybe because they don't involve the CNS too much when there's a reflex arc, so it's faster.
Yes, yes. So a few neurons, they're fast, they are stereotypical, and also they can be involuntary. Okay.
Oh,
so
yes, yeah.
Not the CNS. So automatic, involuntary, short latency, few neurons, and stereotypical. And stereotypical, we said it means whenever we activate this reflex, it will always do the same thing. So we can predict that what will happen in this reflex. So few neurons, okay? We said it's few neurons. You said the reflex arc. So there is 5 components in this reflex arc. Can someone explain what is the 5 components of the reflex arc? Like Lisa cannot talk, so it's either Kirari or Shivani or Lisa.
So I think the beginning, the first one is a sensory receptor.
Yes.
And then
the sensory neuron. Then I guess the integration center, then motor neuron. And
let Kirari try to answer this.
Sorry. She was talking?
It's okay.
So
like I just
sorry. I couldn't hear you. Continue.
Okay, sorry.
Kirari,
and then I guess intermediate or directly go to the motor neurons.
So you said I need 5 things. What was the first one?
The receptor.
The second one?
Should I say receptor neurons? No, it's a receptor. So the second one is intermediate.
Okay, the fourth one?
Fourth one is motor neuron, yes. And the last one is effector.
So you're right. We have the receptor, sensory neuron, the integration center, okay? And then we have the motor neuron and the effector tissue. It can be muscle, gland. So we have the receptor. It's a different cell than the neuron. Then we have the neuron, and then we're in the spinal cord. Then we have some integration center, which basically is the interneuron here. Then we have the motor neuron that goes to the tissue, and then the effector. So everything you said was correct. Now I have two questions, 2 definitions here. What is a Renshaw cell, and what is a relay neuron? Do you know what are these 2 things? Who wants to answer this? So Shivani. Renshaw cell and relay neuron.
I don't know what a Renshaw cell is.
Okay.
Renshaw cell is for lateral inhibition, no?
Yes, okay. So, and what is a relay neuron? Shivani, relay neuron?
Are just intermediary neurons.
Yes, okay. So basically we have sensory neurons are the ones that go from the receptor to the CNS, and the motor neurons are the ones that go from the CNS to the effector. A relay neuron would be something from CNS to CNS. For example, this integration center here, the interneuron, is going from CNS to CNS. So that's we call it a relay neuron. Okay. So it's still a neuron, but it's not a sensory and it's not a motor. So it's kind of a relay neuron. Okay. And then the Renshaw cell, as Kirari said, is basically a cell in the spinal cord that has GABA on it and will do some lateral inhibition. Okay. So when you activate it, it's going to negatively impact the neuron. It's like a negative feedback. So it's kind of a feedback here to control the flexors and extensors. So you can read a bit more about the Renshaw cell. Just know that it exists and it's used for lateral inhibition. I think Panshul will talk about it after, like lateral inhibition.
Yeah, I will talk about it.
Okay, so I'm skipping this one. Nerve fibers. You did this in histology. You know what is afferent fiber? Efferent fiber, classification of them. Does someone know anything about fibers? How do we classify the fibers? Okay. I'll just say it. So basically the fibers, we have four professors, Lloyd, Hunt, Erlanger, and Gasser. And basically what they did is they tried to explain the fibers. Like what do they have? What do they do? Is it about pain? Is it about temperature? Where do they find them? What is their speed? And basically Erlanger and Gasser, they did for both sensory and motor, like afferent and efferent. And they used letters. They used A, C, AA, AB. So they did all the neurons and they used the letters to classify them. Lloyd and Hunt, basically what they did is they just took the sensory nerve fibers and they used the Roman numbers to classify them. So 1A, 1B, 2, 3, 4. They both talk about nerve fibers. We have the characteristics and what they do, like both of them. However, Lloyd and Hunt only explained the sensory fibers, while Erlanger and Gasser explained both sensory and motor. So when we try to talk about a sensory, we specifically use the Roman numbers to make sure that the reader understands that this fiber is actually going into the CNS. So if you can see this that Panshu will explain after, these are actually nerve fibers that go into the CNS, like the direction is from the tissue to the CNS. That's why we use the Roman numbers, 1, 2, A, 1B. So these are sensory fibers, since Lloyd and Hunt just explained the sensory fibers. And since Erlanger and Gasser explained both sensory and motor, we use the letters to explain the motor ones. So if you see alpha, 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 gamma, you are thinking already that, okay, this fiber is going to the tissue, from the CNS to the tissue. So this is the motor one and this is the sensory ones. So we have these two classifications. You can find the speed of each one, where do they come from, where you find them. However, it's just two classifications. One of them is only sensory and the other one is both sensory and motor. So we decided to say, if it's a motor, we use the letters. If it's a sensory, we use the Latin numbers. Everyone okay with this? Panshu,
Yep.
it's anything to add on this classification?
No, it's good. No, it's good. Yes, you can continue.
This drawing is basically the muscle spindle and the Golgi tendon in one photograph, like a scheme, really simple. And you can like memorize it or know how to draw it and then explain it in the exam. It's really the simplest thing to do, and it has everything, all the fibers inside. But Panshu will explain this, how it works afterwards. These are two images, like more colorful. You can see also the fibers, like 2, 1A, and what they have inside. But this is basically like to understand it, not to draw it in the exam. In the exam, draw something like this, or what Panshu will tell you after. It's more simple drawings. So that were the fibers. And now we go to the Golgi tendon organ and the muscle spindle. These two things, I think you did it already, these two things, Golgi tendon and muscle spindle. Did you do these two things already? You learned about it? When? Okay, okay. Professor Vladimir should have explained this to you in your presentation. So what does the Golgi tendon detect? The Golgi tendon organ. What does it detect? Does anyone know?
Tension.
Tension. Wow, is that Katie? Hello,
Yeah,
Katie.
I joined. It took me a second. Sorry. Hi, everybody.
So it detects tension. It means that it's always receiving signal, and based on the different tension, it will change the value of the signal. So this signal is actually telling you the tension in the tendon. However, what does the muscle spindle detect? The muscle spindle.
The stretch.
Yeah, basically the muscle spindle, the change in the muscle length. Okay, velocity of change. Okay, so muscle spindle will detect the change in the muscle length and the velocity of this change. The Golgi tendon will measure the tension. Okay, changes in tension. Why is it important? Okay, I think Panshu will explain this afterwards.
Yep.
Because it goes to cerebellum. Cerebellum inhibits extra signals, so you don't tear your muscles when you jump from a sudden motion or reflex. Panshu will explain this in detail afterwards, and then you can go back to the presentation and read it. Classification of the reflexes. How do you classify the reflexes? I think Shivani started to explain it. Shivani, can you try to talk about the classification of the reflexes?
If you classify them by development, it can be either innate or acquired.
Okay.
And it can be classified by response and then by...
What do you mean response? What do you mean response?
By response, as in, is it like somatic reflex or visceral reflex? So somatic will only control the skeletal muscle contraction, and the visceral one will be for the smooth and cardiac muscles and glands.
Okay, what is the third classification?
Then I think it's by like processing site. I'm not really sure. So the spinal reflex and cranial reflex.
Yes, and the fourth one?
It's either whether it's monosynaptic or polysynaptic.
Yes, exactly. These are the four ways to classify them. Okay, monosynaptic, polysynaptic is what you said. Innate and acquired by development. Visceral, somatic, that's the response, and then spinal or cranial, that's the processing side. This slide is very important. If you can memorize it, it's like basically you have to know all the classifications. Like you have to memorize this. I think Panshul will not disagree. Like these are the
Yeah, definitely. This is very important. This will probably be the one thing, and other than this, there'll be another thing. But this is one of the things that you should remember for your final exam. If they ever ask you with anything for reflexes, this will be the first thing they'll ask you.
Yeah, classification of reflexes. Okay. What is a conditioned reflex? Conditioned reflex. And can you give me one example of a conditioned reflex? Kirari?
Yes, it's acquired one.
Okay, but I need more information than this. Can you explain? It's not basically acquired.
No, it's like a...
It's a specific type of acquirement.
So, like after we are born, we learn this reflex. No, it's not the innate reflex. This is what I thought.
Acquired, but can you explain it a bit, like the mechanism, how you do the conditioning? Because the mechanism to learn these reflexes. Or okay, try one more time. Conditioned reflex.
The definition?
The mechanism, like the
The
step.
mechanism. Oh.
Or I should ask someone else?
I think, yeah, you should ask someone who know better.
Katie, conditioned reflex.
Okay, a conditioned reflex is a type of reflex that is learned throughout the life by repetition, but like the key thing is that between the reflex itself is like something that you hear or you see, or like there's a certain type of stimulus that kind of is not, let's say innate. Like, okay, example.
Wait. I'll help you. So
yeah.
Stimulus does not make a response?
No, it does, but it's not like inborn stuff.
Okay,
like,
okay.
You learn to be scared from dogs because one time a dog bit you or something. But that's not, that's actually limbic system. No, Not a good example. Wait, a
Alex-
different example is the Pavlov, right? Because
Yes,
you
yes.
learn to associate the giving food to dogs or the ringing the bell or the dog sees the plate of the food or whatever, the bag of the food with like giving food to him. So his salivary glands start.
Exactly.
Yeah.
This is exactly what you're talking about. This is Ipe Pavlov
Yes.
from Ipe Pavlova. We know Ipe Pavlova. However, the importance of this is that there is a stimulus, for example, the light. There is a light or a bell or a noise that is not supposed to make you salivate. Like there is a dog. If you put some sound, his mouth will not salivate. It's not the sound to salivation is not physiological. However, what is physiological is if you see the meat, you salivate. Like the stimulus of meat has the effect of salivation. The stimulus of sound does not have the effect of salivation. So what is the conditioning? The conditioning is to try to join two stimulus together, like meat plus sound, and you do the repetition, as you said, and the salivation will be due to the meat, right? However, after so many repetitions, the dog realized that the sound actually means meat, and actually I should salivate. So when you go to the final stage and you have just the sound without the meat, the dog is salivating because it's expecting meat. It learned that, oh, I hear this sound, it means that I'm going to eat meat. So it salivates. So we went from a reflex which was sound to salivation, which was impossible to do, to actually making the reflex from sound to salivation. And this is without the conscious effect. He didn't think, oh, sound, now I salivate. This is subconscious. It's a reflex, right? So the reflex, we do not control it. So we managed to create in this dog's brain a new circuit that when it hears a sound, it will have the reflex of salivation through conditioning. Conditioning is associating two stimuli. One will make the response, in this case salivation, and one will not make the response, like the sound will not make you salivation. However, through repetitions and association of the meat and sound many times, we created a new circuit in the brain of the dog. So now just the sound is actually possible to make salivation as a reflex. Okay, this is called classic conditioning. You take a stimulus that makes salivation, you add to it a second stimulus that is not specific for that effect, and then through repetition, it creates new synapses in the brain of the organism, and then by removing the original stimulus, the second stimulus is now able to do the reflex. Okay, so this is conditioning. Two stimuli, one of them does the effect, another one does not do the effect. Through repetition, you manage to make the second stimuli able to initiate the effect. Okay, Panshul, am I explaining it correctly, or did I?
Yes, it's fine. It's fine, man.
Okay, so everyone okay with this? Like, you understand what you have to say about the conditioning reflex?
Yeah.
So
yes,
yeah,
I understood, but last time when the Professor Blood gave us
the
like a
presentation.
reflex presentation, he wasn't fully satisfied by the answer, like all conditioned reflex, for example, Pavlov's dog, and he wanted to hear an example related to human life. And
No, he wasn't satisfied because nobody said that it was associated with the repetitions and learning, and that's the crucial part, I think.
okay, so still we can use it as a good example for this reflex. He will be satisfied.
Yeah, it will be okay. I think
Okay.
if like Mirna or whoever it was had explained it normally or like with full the details, so it would be fine.
Okay, good. Thank you.
Okay, so next one is, what is a non-conditioned reflex, and some examples of non-conditioned reflex. So Kirari, you said the condition was acquired. So this would be the innate ones. Yes?
Yes.
So an example of innate reflex?
Maybe corneal reflex.
Yes.
Or like the Yeah.
Pedis reflex, reflex grip in the newborns when they're falling, the suckling, the suckling reflex. But basically, all these reflex, I think Panshul will explain. It does not require conditioning. We have them since birth, okay? That's the non-conditioned reflex. Okay, and I think I'm done. I'm done with
Okay, I'm gonna request control. Are you guys able to see my screen?
No.
No?
Try again.
Mm.
Do you have any questions about what I said until now?
Dude, you'll have to give me the control. I don't think you gave me the control. I don't have the option anymore to request for it anymore.
Moment.
Oh, wait, I do. Wait 1 second. Do you guys see it now?
Yes.
Okay, perfect.
Wait, just a second. Lisa Uber said, under which category previous mentioned will conditioned reflex fall? So conditioned reflex will be innate. No, acquired.
No, acquired. A condition would be acquired because the new reflex of salivating with the sound is not innate. It's acquired after the constant repetition.
It would be acquired, visceral, cranial, polysynaptic. I think this reflex. Acquired, visceral, polysynaptic, cranial.
Yes. Any other questions, guys?
Okay. No, we can continue.
Okay, so what I'm going to discuss with you guys is the type of reflexes and their mechanism. And to understand this, we are going to first understand how the muscle spindle and Golgi tendon organ works. So there are going to be 3 receptors that we are going to mainly look at the reflexes of. So one of them is the muscle spindle. The other one is the Golgi tendon organ, and the next one is the nociceptors. Nociceptors are pain receptors. So to just keep in mind that there are 3 receptors: muscle spindle, Golgi tendon organ, and nociceptors. And now we're going to move on to the type of reflexes. 1 second. Okay, yes. So can anyone tell me where the muscle spindle and Golgi tendon organs are present in the muscle? Any ideas?
Yes, the muscle spindle is inside the muscle, like in the middle-ish, like where the bellies are.
Okay.
And the Golgi tendon is near the tendon, like muscle tendon junction.
Exactly. So where the muscle spindle, so the muscle is divided into what is called an extrafusal fiber and intrafusal fiber. The intrafusal fiber has 2 more components. One is a contractile component and one is a non-contractile component. The non-contractile component is what these muscle spindles are. So this is where the muscle spindles are, and this is where the Golgi tendon organ is. Now the Golgi tendon organ is present on the tendon because it's in the name. It's Golgi tendon organ, and what it does, so what the muscle spindle does is it detects the like we had already discussed, detects the distance and the speed, or it collects the proprioceptive feedback of the muscle. What Golgi tendon organ does is it detects the stretch on the tension in the muscle. So it's the job of Golgi tendon organ is to figure out is to prevent over contraction of the muscle. So if there's a threshold set at the Golgi tendon organ, if the muscle tension crosses that, it will activate and it will start sending signals. So this is how these 2 receptors work. Now we're going to take a very simple example. Let's say if I put my hand in front of me and I keep adding weights, what would happen is that there'll be a small stretch on both the extrafusal fibers and intrafusal fibers. And because there's a stretch on the intrafusal fibers, these muscle spindles will start to activate, and they will send activation signals across the dorsal root, and you can see that they're directly synapsing with the alpha motor neurons, and they will directly synapse with this, and they will activate the alpha motor neurons, and this alpha motor neurons will contract the extrafusal fibers. So this is the simplest loop of activation of muscle spindles. Now the issue with this is that if the extrafusal fibers contract, but the intrafusal fibers do not contract, what would happen is that suppose during contraction, if the muscles, the extrafusal fibers contract, the intrafusal fibers do not contract, the muscle spindles will become inactivated for a while because they are not taut or they're loose. They will lose because they're loose. They will not be activated. And if they're not activated, if I were to stretch my muscle again after contraction, they will not be able to detect anything because they are too loose to detect anything. Now, in order for us to correct that, or in order for the muscle spindles to remain sensitive, and in order for them to be able to collect the proprioceptive feedback after the contraction as well, there is something called a active contraction with co-activation with gamma neurons. Now, the way this works is, again, we'll follow the loop. We stretch the muscle. As soon as the muscle stretches, the muscle spindles will go and activate the alpha neurons, but at the same time, they will send signals up to the CNS and the CNS will send the signals back, and these signals will activate what is called a gamma motor neuron. What gamma motor neuron does is that it will activate the alpha motor neurons as is, plus the gamma motor neurons, and the gamma motor neurons will activate the will contract the contractile part of the intrafusal fibers. So now when the muscle contracts, the extrafusal fibers and the intrafusal fibers contract, due to which the intrafusal fibers remain taut, so they have some form of tension. So as soon if there is a stretch on the muscle after the contraction, the intrafusal fibers will still remain sensitive to any kind of stretch. Do you guys understand how this muscle spindle works? If you have any doubt, you can ask me now.
But I thought that it was a non-contractile unit, the muscle spindle.
Exactly. So like I said, the intrafusal fibers are itself made of two components. There's a contractile and a non-contractile part. So the non-contractile part of the intrafusal fibers are the muscle spindle, but their contractile part is what is connected to gamma motor neurons. Does it clear it?
Like in the periphery, kind of the...
Yes, exactly. So if I were to draw a diagram of it, I can't in the center of the intrafusal fibers. In the center of the intrafusal fibers will be the muscle spindle, while outside it there is still contractile fibers. Does it explain it?
And we want them to contract along the muscle so that...
Exactly.
Like, wait, so to detect like the stretch when it's contracted, them I don't understand. Like,
okay. I got where they. Okay, so if suppose you so if the extrafusal fibers contract, so in this case, one second. Extrafusal in this picture, you can see the extrafusal fibers contracting, right? While the intrafusal fibers are not contracted, and you can see that they are just taut. They're just loose. If they're loose, the way the intrafusal fibers work, or the muscle spindle works, is it detects the stretch. As soon as it's stretched out, it gets activated. But if you were to contract the extrafusal and prevent the if you were to make the intrafusal loose, they will not be able to detect anything after the contraction because they're just too loose to detect anything. They're too loose to even stretch enough. But if you were to contract them as well with the other muscle, with the extrafusal fibers, they would remain taut. I mean, they will remain like this. They would still remain taut with the extrafusal fibers. And if there was to be a stretch now, because they're still taut, they still have some form of tension in them. If I were to stretch them, they would still be able to detect. They will still be sensitive to the stretch. Do you get it?
Yeah, I understand now. I don't know why I thought that like when a muscle is contracted, so it's like more in a way the job of the Golgi tendon to like express the tension or like how much load on the muscle. I don't know.
Maybe so what Golgi tendon organ? No, I got it. So I shall explain what the Golgi tendon organ does. So if you understand how the muscle spindle works, the way the Golgi tendon organ works is that it has a certain threshold that is set by the CNS, or a certain threshold. This threshold is what above this threshold, or threshold of tension. Above this threshold of tension, it gets activated, and above this and this tension above the threshold is what will be damaging to the muscles. So what it does is tries to prevent any over contraction of the muscle, to prevent any kind of damage to the muscle. Its job is to prevent any kind of damage. So as soon as there's tension in the muscle that the muscle cannot handle, the Golgi tendon organ will activate. It will send the signals back, and it will activate what is called an it'll activate what is called an interneuron over here. Wait, let me clear this up. It'll activate this interneuron, and this interneuron is inhibitory. So we had discussed before, right? There's an interneurons that those are Renshaw cells. These are the Renshaw, the inhibitory neurons that will inhibit the alpha motor neurons and prevent them from further contracting. So in order to prevent any kind of damage that could result in the muscle if the muscle were to continue to contract. Do you get how the Golgi tendon organ and the muscle spindle works now, or do you have any doubt?
Wait, I have a question. Why do you need, like, when the muscle is already contracted, let's say it's not like it's full capacity of contraction, it's somewhere in the middle, let's say. So then it's like the job of the muscle spindle to tell you like how much there is more to contract, basically, you know, or what?
So it gives you proprioceptive feedback. How much? Yeah, exactly. What is the distance and what is the velocity at which the muscle is contracting? So so it gives you proprioceptive feedback to where the muscle is in the air. If proprioceptive means the position in space.
So then you change the position of your arm, let's say, and then like the muscle spindles will reset to the new position, and then it.
Exactly. Because you need to be, no problem. But does everyone understand? Hello, guys. Do you guys understand this?
Can you roughly explain like the Golgi tendon organ again? Like I'm getting confused.
Okay, what are you confused about it? What do you think is the function of Golgi tendon organ?
I'm getting confused with the Renshaw cell part.
Okay.
So basically, Shivani, the Renshaw cell is the connections between the fibers. However, like the first step is to understand the function of this circuit. So we have a Golgi tendon organ circuit, and then we have the muscle spindle organ. So first, try to understand what is their functions, how they work, and the second step will be to understand how they are connected together. So you're asking about the connections, but Panchul is asking you, do you know the function? Like, what is it supposed to do? Like, why do we need it? How it works?
Do you understand that part?
So if you understand how it works and why it's needed, then Panchul will explain again the connections, like which neuron goes where.
So the Golgi tendon organ is like a proprioceptor, which is like receives information from the tendon and it senses tension.
So proprioceptive is so the right definition of proprioceptive is that it is the position in space, and that's the function of muscle spindles. The Golgi tendon is responsible for preventing any overactivation of the muscle. Your muscle has a certain limit to which it can hold tension in itself. Like if you were to pick a 50 kg dumbbell, I can't hold it in my hand. I can't keep it in my hand. And the reason I can't do it is because my Golgi tendon organ will prevent me from doing that. It will, as soon as I try to lift it up, as soon as I try to curl it in my arm, as soon as it detects that it's 50 kg and my muscle cannot handle it, it will direct my muscle to drop the weight and my hand will just collapse.
So basically, it doesn't matter how much muscle you have, your tendon will be destroyed after some kilograms, some tension. So
and all of these muscle tendons have that particular threshold, right?
Exactly.
Yes,
it's set up.
So if as a whole muscle, it has to be synchronized together?
For a whole muscle?
That's the muscle spindle. The Golgi tendon is protection, basically to try to protect you not to have a lot of tension, not to over.
Okay.
otherwise the muscle will just get destroyed. It won't be able to handle the weight, and if you try to curl it, it will just tear itself. In order to prevent the muscle from tearing itself, this Golgi tendon organ is present there to prevent that further or over contraction.
Have you seen videos on YouTube where two guys are making arm wrestle with their hands, and then one guy is so strong that it breaks the hand of the other guy, like you saw, like you destroy the ulnar and the radius because it's so strong. Have you seen videos like this?
No, but
Okay, so basically, if you use your muscle, it doesn't matter how strong you are. If you use it too much, your tendon will break. It will be cut. So the Golgi tendon will detect the maximum tension that your muscle can, your muscle and the tendon can undergo, and then it will tell the muscle, you know what, we are under a lot of tension, so please relax all the muscles to relax the tension.
And is this threshold the same for everyone, or does it change depending on people?
It changes. That's why if I lift, I think it's adaptive because I can lift weights slowly. Over a period of time, I can lift more and more weights.
So it's
an adaptive response. Exactly.
Okay, thank you.
And this is a reflex, so it doesn't matter how willing you are, how much your cortex puts the signal inside. It's a reflex. Your muscles will automatically relax.
Yeah, I get it. Thank you.
And is the tension the same for all muscles, or is it different per each muscle tendon?
It should be different because if I were to I mean, this is, I don't know it from a book, but I know it from like experience. If I can lift more weight with my I can push more weight with my leg than I can with my arm. So it's, I think, different for different muscle.
It depends on the size of the tendon. Like the legs have big tendons, the hands has less tendons, the facial, the neck muscles have less tendons.
General mass of the muscle is different. Your quadriceps are a lot bigger than what your biceps or your forearm muscles are.
Okay, last question on the topic.
Yes. Go ahead. No.
Does the tendon adjust in a way to the muscle size if you build or just in general?
I would the tendon adjust. Yeah, I think the tendon does. If you what do you say? If you were to push your muscles to the maximum every time you exercise, you would slowly have an adaptation response in the tendons as well. But again, this is not through a book. I think it should be adaptive, and it should become stronger as you train the muscle itself.
But this is for chronic. So if you're asking acute movement,
exactly,
the tendon will be the same. The only thing that changes is the length of the intrafusal and extrafusal muscle fibers. So like if you speak about physiology in your exam and they ask you when we have the reflex or when we move, then the tendon will not change the length. What will change the length is the intrafusal and extrafusal muscle fibers.
Yeah, okay, thank you.
Okay, any other question? I remember you want the question on these cells. I'm not sure if they're called Renshaw cells, but Renshaw cells are inhibitory neurons, but this interneuron is an inhibitory neuron. Now, the way to explain the circuit of Golgi tendon, as soon as there's a weight the Golgi tendon organ detects is too much for the muscle, it gets activated. As soon as it gets activated, it will activate these fibers. These sensory fibers will go and they will synapse with this interneuron over there. Now, this interneuron itself is an inhibitory neuron. So as soon as this neuron is activated, it will further release GABA and negatively it will inhibit the alpha motor neurons. Now, if it inhibits the alpha motor neurons, these neurons will fire less and the muscles will relax. Does it explain the circuit of Golgi tendon organ?
Yep.
Perfect. Okay, so we discussed how these two of these receptors work, and we have understood how they work, and now we're going to discuss the types of the mechanisms and types of reflexes related to these receptors. Now, there is another receptor I was talking about, the third receptor, which is the nociceptor. Now, the mechanism is quite simple. If there is any kind of pain stimulus, physical, mechanical, physical, temperature, chemical, that will activate the sensory neurons directly. Okay, so we have 3 receptors out of the way. Now we have to understand the types of reflexes. The first one is the stretch reflex or the muscle spindle reflex. Now this is the one we just did when we were trying to understand the mechanism. So it's the one where the stretch. So in this one, you can see if I add load to the arm, there will be a small because I've just added the load, the muscles and will start to the arm will be load a slight will be lowered a little bit, which will cause the stretch of the intrafusal and the extrafusal fibers. That will, and because the stretch is there on the intrafusal fibers, they will activate the sensory neurons that will go and directly synapse with the motor neurons and will activate the motor neurons that will cause the contraction, and the arm will regain its normal position. Now this was the simplest loop, and that's why, and because it has only one synapse over here, it's considered it is a monosynaptic reflex. So that stretch reflex is a monosynaptic reflex, and it involves this muscle spindle. Now there is a muscle spindle reflex. If I were to add reciprocal inhibition to it, and so there's the next reflex is the knee jerk reflex. In this knee jerk reflex, there is the muscle spindle reflex plus a reciprocal. Now the way this works is, if I were to tap on the tendon of the quadriceps like so, what would happen is this tapping on the tendon would stimulate the stretch on the muscle, and because there's a stretch on the muscle, there'll be a stretch on the spindle fibers, muscle spindle fibers, which will again get activated. They will go in root ganglia and will go into the dorsal root of the spinal column. And as soon as they enter the dorsal root, they'll follow one mechanism of the one we just discussed, the first one, the muscle spindle reflex. So one of them will just be muscle spindle reflex, where the sensory neurons activate the alpha motor neurons. And these alpha motor neurons will cause the contraction of the quadriceps. But also, we said that this knee jerk reflex has another factor to it, which is the reciprocal inhibition, in which the sensory neurons not only will activate something called an inhibitory neuron, which will inactivate the alpha motor neuron of the extensors or your hamstrings and cause them to relax. And that's why your that's why your leg will move forward. This is the knee jerk response. Do you guys understand how this knee jerk reflex works? Do you have any doubts?
My question is if in this case, it does not affect Golgi tendon, right?
No, it does not, because we are not pushing the muscle to the absolute threshold right now. We are just stretching the tendon to stimulate the effect of a muscle being stretched.
Okay.
Does it make it clear? I know where the doubt is, because I had the same doubt when I was making the presentation.
Because it's tapping on the tendon, you know.
Yes, exactly. But the thing, the key factor is that the Golgi tendon organ is not responsible for measuring small changes in the tension. It's only responsible when there is a tension that muscle cannot handle. It has a certain threshold before which it will not get activated at all. But on the other hand, this muscle spindle has the job of detecting any kind of changes, any kind of changes in the muscle all over. And that's why if I were to tap the tendon, it would stretch the muscle just for that 1 second. That would stimulate the effect of that muscle being stretched. You get it?
Yes.
Perfect. Any other doubts? I'm going to move on then, if no other. Okay, perfect. Okay, so the next, so we have discussed the reflexes related to the muscle spindle, and again with the muscle spindle and a reciprocal inhibition. Now we're going to go to the Golgi tendon reflex. Again, this reflex is also called the clasp knife reflex, and we have already discussed pretty much how it works. So if I were to add a load on my arm that I cannot handle, what would happen is it would activate the Golgi tendon, and this Golgi tendon would send sensory fibers again to the dorsal root. In the dorsal root, it would activate an inhibiting neuron, which would inhibit the alpha motor fibers, alpha motor neurons. This alpha motor neurons inhibition would lead to the arm to collapse, and that would and that's the clasp knife reflex or / the Golgi tendon reflex, Golgi tendon organ reflex.
Can I add the correction to this one?
Yes.
The Golgi tendon reflex is physiological. However, the clasp knife reflex is pathology. It's It has to do.
Okay.
It has to do with the triceps. It's the triceps. It's the same thing, but for triceps, and it's for the hand going inside, like when there is
Abduction is
yes.
Add is inside.
When the biceps contracts, the triceps is stretched, so the triceps has this Golgi tendon reflex and lets the hand go inside. So,
okay, maybe you explain this because I don't know about this pathology.
Okay, so basically, if you have upper motor neurons and lower motor neurons, you know, like the same as a facial nerve or everything, basically. So upper motor neuron is basically when your cortex is not able to talk with the muscles. So the only talking is between the spinal cord and the muscles. So because the Golgi tendon organ is going to the spine and then coming back to the muscle, so it takes over. Basically, clasp knife reflex should not be there because our cortex takes over the Golgi tendon. But if you have a lesion in the upper motor neuron, so your cortex is not able to control, everything happens through the spinal cord. So the Golgi tendon organ takes over everything.
Okay.
You can see this effect. You can see this effect when your hand is going towards your shoulder. So in the beginning, the hand is always contracted because of the paralysis, the spastic paralysis. However, when it reaches your shoulder, the Golgi tendon of the triceps, it tells the triceps, you know what, you have to relax. That's why it closes and you hit your shoulder. So in the beginning, there is resistance in your hand. And then when you come close to your shoulder, there is no resistance because the tricep is not contracting anymore. So this is the same effect, but when the biceps is relaxing. So it's on the opposite side. So when you put weight on the hand, the Golgi tendon reflex, you put the weight on the hand, it's too much weight, and now the biceps will stop to contract. So the Golgi tendon reflex is when the stretch on the tendon is so much that it decides to relax completely, to fail, muscle failure. It fails to contract, it relaxes completely, and then you lose all the weight in your hand. So if you see on the right image, the muscle, the biceps, decided not to contract anymore. So the whole weight is fall on the ground. That's the Golgi tendon reflex. And clasp knife is the most used clinically in neurology reflex to see if the cortex, the upper motor neuron, is talking with the muscle or not. So if you have this clasp knife reflex, it means that everything happens at the level of the spinal cord and the Golgi tendon is the master of the reflex. So that's my correction.
Do you guys understand it?
I didn't understand, like, what's the difference between that and the normal Golgi tendon reflex then?
The normal one is the one in this picture. The clasp knife reflex is the one Stelios explained, which is a pathology.
So basically, clasp knife reflex is for the triceps, and the Golgi tendon is for everything, basically. It's in a general term. Clasp knife reflex is a specific for the triceps under pathology. It's like a specific example.
Okay, so guys, what I'll do is my fault. So what I'll do is you guys just remember for now, the Golgi tendon reflex is what you can see right now. Forget about the clasp knife, and I'll make another slide and I'll send it to you. I'll ask Stelios to make another slide and I'll send it to you guys. Just for now, remember Golgi tendon reflex is when there is too much tension in the Golgi tendon because of the excess weight. It causes the inhibition of the motor neuron and causes the hand to just collapse. Does it get clear?
Yes.
Yeah.
Okay, perfect. Okay, so so we have discussed the Golgi tendon reflex, and we have discussed the muscle spindle and Golgi tendon. Now we have to go to the third receptor, which we remember is the nociceptor. In the nociceptor, we have two of these reflexes. Now both of these are not separate; they are mutually they're mutually together. So the first one, let's see. So the way I said that nociceptor works is that if there's any kind of painful stimulus, it activates the sensory neurons. These sensory neurons go to the dorsal root. In the dorsal root, it activates. So the first reflex we're going to talk about is the flexor withdrawal reflex, in which we want the leg to flex away or go away from the painful stimulus. For that, for us to be able to do that, the sensory receptors inhibit the extensors, they inhibit it, and they activate the extensors, due to which your leg will bend and it will go away from the stimulus. But I said what I said before was that there's another reflex that goes with it. Now, if one leg is contracting, you want the other leg to stay in ground and support you, otherwise you'll fall down. Now, for that to happen, we have another reflex that is called the crossed extension reflex. Now, it's in the name. It's an extension of the leg across the first leg. We want the other leg to stay in ground and to be able to bear the load of the whole body, so you don't fall down. So for that, it's the same neuron. Now, instead of the same neuron goes and activates the contracts the quadriceps and relaxes the hamstrings, making the leg extend, and that helps you to maintain the weight. And that's the crossed extension reflex. Do you guys understand how this works? How these two reflexes work together?
That is a polysynaptic?
Yes, exactly. Polysynaptic.
Yeah.
And it affects two different limbs. So it's important. It's two different limbs and two different groups of muscles.
Yeah, and remember the names also. And don't get confused with the names. Do you guys get it?
Over here, the afferent is from the alpha sigma fibers for the flexor reflex.
Alpha, the efferents are not alphas. There will be one second. It'll be from the it'll be one of these one A, 1, 2 receptor.
Yeah, not alpha, I'm sorry. It's A sigma.
A sigma, the efferents? There will be
afferent.
Afferent, the nociceptors. I don't know. Salius, do you remember from your presentation what the pain receptors were and what nerve fibers were taking them? I don't remember from. I think is there any presentation? I don't remember what it was.
It's the delta.
Okay.
Like sigma and delta look similar, but delta is it's delta.
Okay, so delta fibers are the sensory fibers that take the painful stimulus to the dorsal root.
Okay, thank you.
No problem. Okay, so I'm gonna move.
Never heard of a sigma, so maybe I think it's delta. I am sure it's delta. So I think Shivani misunderstood the delta for sigma.
Okay. Okay, so since we discussed these reflexes, which of them are monosynaptic and which of them are polysynaptic? Which reflex is this? Is it polysynaptic or monosynaptic? It's a stretch reflex.
Mono.
Yes, exactly. What about this one? Second one.
Poly.
Yes. Third one.
Also mono.
Why?
We said it's mono, no?
But we don't. Okay, let's go back.
It's
or do you mean the one with the knee? No, it's not the one with the knee.
Wait one second.
Clasp knife.
Yes, this one. Yeah, I mean, it's sorry. Don't.
Yeah,
sorry,
the Golgi tendon reflex.
I will show you in the video in the end.
Golgi tendon. Now remember, there is an inhibitory neuron in between, so it makes it a what and not monosynaptic.
So it's poly because it's not only like one synapse.
Exactly, because there's that inhibiting neuron in between for that. So this will make it poly. What about the flexor withdrawal effect and the crossed extension reflex? What about these two? Katie, you already said it.
Wait, I'm writing down something. Somebody else can answer.
Okay. What about these other last two reflexes? What do you think? Monosynaptic or polysynaptic?
I think both of them are polysynaptic.
Yes, exactly. Both of them will be polysynaptic. Okay, so we have discussed the main reflexes that we wanted to discuss. There are other reflexes like the pupillary reflex and the oculocardiac reflex, and there are a lot more reflexes like 10, 20 more reflexes that maybe I can send you a Word document that has all of them, but these are the main ones that you should know. So again, the pupillary reflex this is a diagram. You can go over it, but basically I think you already know what it is. If I were to shine light on my eye, my pupils will constrict, and the pathway is present in this diagram. The same for there's another reflex, which is the oculocardiac reflex. Now, in the way this reflex works is that if there were to be a pressure on the eyeball, it would cause sinus bradycardia of the heart. Now, the places where this will be important, or the places this is applicable, is that in case of facial trauma, or in cases of eye surgery, where there's a possibility that the eye would have I would experience any high pressures. And there are many more. You guys can go over it on your own time. The next thing we're gonna go over is the reflex evaluation. Now, to evaluate the reflexes, there is this chart, and what it does is based on if the reflex is present or if it's absent, and if it's present, then if it's hyperactive or if it's less active. Based on that, you give a person a score, and this score then can be used for further diagnosis. And what is laterality? Does anyone know what laterality is, and how do we measure it? A simple definition of what it is. Anyone? Okay, so what laterality is?
Okay.
Okay, go ahead. Sorry.
No, I don't know. Okay, I see it and I was wrong.
It's okay. It's okay. So laterality is basically the preference of one side over the other. Now, the etiology of it or the cause for it is unknown. But so we all know that we can be right-handed, left-handed. We can have different kind of. So there's a preference to one side of the body over the other. Now, the thing to understand is that it is not synonymous. So it's if I were to have right-handed preference, it doesn't mean my right brain is preferred, or also my right eye is preferred. It can be any kind of combination. It can be my right hand, left eye, left brain, right leg, anything, any kind of combination. And the test we used to determine it, or the one we were going to use in the lab, is called the laterality index. And so, and that's it. Do you guys have any questions?
Yes. Is it only for paired organs?
For what? Sorry?
Paired organs like eyes or limbs or.
I think if you were to take a sagittal section, right? Sagittal section right in the center, that's how you would do it. But paired organs, I think spleen you wouldn't consider. Yes, it's for paired organs. That's the only way you will have laterality or preference over one over the other. If there is no other, there is no one. But again, I think so at least. Celios, any idea?
It has to do with the motor cortex, like on one side is more developed than the other hemisphere. So since it's contralateral, if you have a strong left motor cortex in your left hemisphere, then your right side will be stronger, and you are going to use that and that more and more. So your primary cortex and your left hemisphere will become even more like stronger. You know what I mean? So it has to do with the brain mostly. I don't know about the reflexes. I don't know if it affects the reflexes, but maybe it affects it as well. So I know about the muscles, the voluntary control. I don't know about the reflexes.
Any other question, guys?
So when we say hemisphere, we mean primary motor cortex, so voluntary control, everything that is muscles, voluntary control. For autonomic, I don't think. So autonomic, I don't think there is laterality. But for the muscles, voluntary control, yes.
Okay. And the last part is just the difference between reaction time and reflex time. And it's a very simple difference. Anyone want to take a guess on it? No? Okay. Well, basically reaction time is the time difference, or the time between the stimulus and the voluntary response. And the reflex time is the time between the stimulus and the involuntary reflex. And that's the only difference. And that's it. Any questions from the previous slides? If I want to make sure you guys understand the first parts of those reflexes and the mechanisms. If you have any questions, ask now. And this is the end of my presentation, so I don't have any other
Like, I got a little bit confused where came the cause whatever Golgi tendon thing. Is it something that like important so I could like view it later in the recording, or what to do with this?
What question do you have? I'll explain to you now if you have any doubt on it.
Like, because I remember the Stelios says it's pathology, but like I didn't understand the whole thing about why is it pathology and whether I need to know it or not.
Okay,
Right.
so that part, yeah. Okay, so what we'll do is just forget about the pathology part now, because even I have to actually look over it, and Stelios will probably will have to make a slide on it, and then we'll share it with you. For now, just remember how just the Golgi tendon reflex works. Forget the pathology for now.
Because also the Golgi tendon, it's not responsible for the relaxation of the triceps, or is it?
It is. It is.
It is.
It is responsible for relaxation of all muscles so they do not break.
No, yes. I mean, I understand why it's for the biceps.
And
but
also the legs, everywhere you have muscles that have tendons.
No, wait, that's not my question. My question is like, let's say the Golgi reflex was activated in the biceps, right? Yeah. But for the biceps to relax, so the triceps have to also contract, right?
No, it does not. Because you are not doing a movement on the opposite direction, you're just relaxing it, and the tension, for example, in this image, it's the weight that makes the hand go down, not the contraction of the triceps.
So yeah, it's just a complete relaxation. There is no contraction anywhere. It's just the weight, exactly like how Celio said. I think what you're getting confused is in the knee jerk reflex. Because
no, I understood it. I understood the knee reflex.
Okay. In that, we need in the knee jerk we require another. Oh, sorry, not the where is that? The other one we require the relaxation of the other muscle, because the contraction of one and the relaxation of the other for the leg to move up. But in this case, it's just the weight dropping the arm. There is no contraction in the arm itself.
So I can decide to relax the biceps without affecting like the length or anything of the triceps at all?
If the Golgi tendon were to be activated, the triceps would not need to contract.
So it's just like the passivity kind of the situation.
It's what kind of situation? Sorry, it cut for me.
I think I understood. Okay.
Okay, that's good. Any other question?
Can I show something on camera? Like, can you close the screen?
Yeah. You can. Okay. Yes. Now you can try.
You can see, right? Can you see me?
Yes.
Yeah.
So basically, the muscle spindle, how it works is, imagine you have like a pen with a rubber band on it. So if it's loose, the rubber band has no idea what's going on. Like, it has no idea about this or this or this. It cannot understand the differences. So in order for the muscle spindle to always know what's going on with the length and the forces, is to be always tensed. So now if I have the string, the rubber band stretched, it knows that, okay, I am, let's say, 1 meter long. If I stretch it more, it recognizes the difference in the length. So what I have to do is to keep the rubber band always tensed, because if I lose the tension, it's not able to measure the length. Okay. However, the intrafusial fibers of the muscle are not elastic. So since they are not elastic, I have to use muscle contraction. There is some muscle fibers inside the intrafusal that they contract, and the intrafusal contraction of these fibers will make the size of the muscle spindle to be the appropriate size. What is the appropriate size? It's the same as the length of the muscle fibers, the extrafusal. Okay, so it's the images that Panchul was trying to describe. So what happens in the knee jerk reflex? So I have, if this is the patella, the patella, and this is the hip, quadriceps. So on the other side, then the muscle is at a specific length. So when I hit the patella, what is going to happen is the muscle is going to expand because I hit the patella down. So the muscle is going to expand rapidly. So if it expands rapidly, the muscle spindle in this muscle is going to detect I expanded very fast. So what I need to do is I need to contract to make it back. So if I expand it really fast, the extrafusal muscles will contract back because it's supposed to be in this length, not to be bigger. So this is the knee jerk. So you squish the patella downwards, the muscle spindle expands, and then it says to the muscle, oh my God, you need to contract back to go to the set length. So that's why when you hit the patella, the knee will go up because you hit it and then it goes up because it has to bring the extrafusal muscle length to the same level as the set one. So it has to be really fast. Like you hit the patella and then it contracts. So that's the muscle spindle. Okay. It must always be the same length as the extrafusal fibers. However, it's not elastic like the rubber band. So we need to contract and relax this muscle spindle all the time. Okay. So if it was elastic, we wouldn't need to contract it. It will always be by itself adjusting the size. However, it will not work because we need the muscle for other reasons. Anyway, so this is a clamped knife. So how these knives work is that if you are towards the closing, there is no resistance. So now it's easy to move. However, all the other degrees, it's very hard. It's very hard to move it. Now I have a lot of tension. I need a lot of strength to move it. Now I don't need any strength to move it. So basically, if you imagine that this is the humerus and this is a radius and ulna, so this is the arm, like on the lateral side. What's happening is that if you have upper motor lesion pathology, triceps and biceps contract at the same time. So the biceps and triceps will contract at the same time. This is called spastic paralysis. Why paralysis? Because you cannot control it. Your brain, your upper motor lesion is destroyed. So for example, if I cut the spinal cord at this level, then I cannot control the biceps or triceps, and both of them are contracting, okay? So that's why it's called paralysis. And why is it spastic? Because both of them are contracting and I cannot move it. There is a lot of strength. If I go up, it means I am going against a contracting triceps. If I go down, it means I'm going against a contracting biceps, and both of them are contracting at the same time. So the entire hand is very difficult to move. So what you do to the patient is you get his hand, you get his humerus, and you say, okay, now I'm going to push your hand up, and you feel the biceps and triceps contracting. So it's difficult. And then up to a point. Now at this point, the triceps is so stretched, plus it's contracting at the same time. So the tendon of the triceps, it sends a message to the triceps and tells it, look, you are contracting, someone is pushing against us, there is a lot of tension in the triceps tendon. So what we're going to do is the triceps has to relax, okay? So we reach the limit, the triceps needs to relax. However, the biceps is still contracting because of the pathology. So in these degrees, the tricep does not contract anymore, so it's easy to do it. So from here until here, it's very difficult to move the hand of the patient. However, in the last degrees, it's so easy because the triceps is, the Golgi tendon of the triceps is overwhelmed, and it tells the triceps, stop contracting, you need to stop contract. So that's why it's called the clamped knife reflex, because everything is hard except the last degrees. These degrees is so easy to do. So that's the clamped knife reflex. And you can use the distance that it has to always be the same for the muscle spindle. I hope you understood.
That was really good explanation, guys. I don't think we'll get anything better than that.
Good job with the props.
Yeah.
Okay, so yes, the easiest physiological Golgi tendon to explain is the one that Panchul said with the weight. Like you get someone with the hand and you put weight on him. at one time it's going to like fail. The muscle is going to fail due to the too much pressure. So it has to do with one muscle only. So with the clamped knife, it was the triceps. It said, you know what, too much pressure, we need to relax. So it has nothing to do with other muscles. It's only about one muscle that is going to be destroyed. So our body says, instead of destroying it, let's just relax. It's better to relax and lose this function than basically destroy it forever, you know? So that's the two things.
You guys understand now?
Yes, very clear.
Yes. Okay, then.
So
I don't have anything else.
Can you go show again the muscle spindle, the three images, that how the muscle first contracts and then the intrafusal has to contract to bring it back to the same size.
This one?
Yes.
Intrafusal, wait, intrafusal.
Number 3, 4, and 5. Like in 3, if you go in 3, can everyone see me in the video as well? Can you see my video as well?
Yeah, actually I can.
So at this point, the muscle is the same intrafusal and extrafusal. If you go in the next photo, so the muscle basically became smaller. However, it does not detect the intrafusal, the muscle spindle does not detect anything now because it's not stretched. So what I'm going to do is, because it's not elastic, I'm going to say to the gamma motor neuron, I'm going to say, you know what, muscle spindle, you are too big. You have to contract to go to the same size as the extrafusal muscle. Okay, so this happened, you see? So you understand why we have the gamma motor neurons? The function of the gamma motor neurons is to make the muscle spindle always be the same length as the extrafusal fibers, okay? So number 3, 4, and 5 shows that my muscle contracted. The intrafusal fiber is too big, so we contract it with the gamma motor neuron to make it the same size. So exactly. That's the muscle. Everyone okay with this?
Yes.
Yes.
Okay.
Any other questions? Like, we are your assistants. You have to ask us questions.
Yeah, you'll have to ask this question. Also, if you guys want, I have written the definition or the explanation down here. And when you get the presentation, you should be able to review the explanation again.
Okay, so I think we can just finish.
Okay.
Okay, thank you guys.
No problem at all.